Hi, I'm Danielle, a pediatric and perinatal nurse educator at West Coast General Hospital. Today, I would like to take the time to welcome all expectant families from our service delivery area. We would also like to take the time to introduce you to our delivering providers and our public health and neonatal youth nursing services, part of supporting you and your family's journey into parenthood.
Hi, I'm Dr. Herman Nell. I've been doing obstetrics for about 31 years in town. I do regular deliveries, epidurals, cesarean sections. People can be referred to me through my office at 9th Avenue, and the information is available online.
My name is Annelien van Zyl. I'm a family doctor in Port Alberni. I've been delivering babies about 22 years. I do hospital deliveries and all the prenatal care, and I also assist moms for their C-sections here in hospital, and then I usually follow them for the first 4 months postpartum. And you can get referred to me if you ask your family doctor or your nurse practitioner.
Hello everyone. Hello our Port Alberni residents, probably pregnant residents right now. My name is Mike Fuad. I'm an OBGYN in here, and because of COVID we thought we should like to give you a video tour of our facility. As you can see, we have beautiful views here and the sun is coming out. So it will be our pleasure to have you here, and it will be our pleasure taking care of you.
Hello, my name is Francine Gascoigne. I'm the Community Health Nurse Clinical Lead with the New Channels Tribal Council. We provide our nursing services to 13 of our New Channels nations across Vancouver Island. The NTC nurse can follow you along your journey right from the beginning of even providing a pregnancy test. Prenatal supports include individualized plans, and once baby is born, there are the postpartum visits include breastfeeding support. The visits are right in your home. The nurse will normally visit once a week for as long as the mom chooses how long she wants to be connected with the nurse. There's a welcoming blanket that is gifted to the baby, and there is a welcoming baby ceremony called Nanayaksha that usually happens twice a year at the Port Alberni Friendship Center. And we also have the well baby visits, which includes the nurse weighing your baby, measuring the length of your baby, and the nurse will also talk about the immunization program that we have to offer. NTC nurses are really always happy to be connected with women in their pregnancy journeys and following them after baby's born, so we look forward to connecting with you.
Hi there, my name is Sarah Bjorgen, and I'm one of the midwives at Port Alberni Midwifery Clinic, and this is my associate Sora Colvin, registered midwife. About 3.5 years ago, I came to Port Alberni as the first midwife to open a practice, a full-time practice here, live and to live. We offer services here in Port Alberni and also out to the West Coast. We have a satellite clinic to families in Tofino and Ucluelet, and we also, through the First Nations Health Authority, serve right now Tyastanis and Howzit.
So we're primary care providers for pregnancy, birth, and the postpartum period up till 6 weeks. Our model offers shared care providers. So you'll meet both me and Sarah during your prenatal course of care. You can choose between hospital birth at West Coast General, where we both have privileges, or home birth if you have a low-risk pregnancy. And then we continue to see you at home or in our office for the first 6 weeks postpartum, taking care of both you and baby. And you get a very individualized experience. We really believe in supporting your choices for what's best for you and your family throughout the course of your care.
We're paid for by MSP, so there is no cost to a woman to choose a midwife. Everything that MSP pays for is covered. We can order your ultrasounds, all the regular tests that you would require, drugs for you in labor, pain medication in labor. And if you need something that's beyond our scope, we consult generally with an obstetrician or a pediatrician for the baby afterwards, but that doesn't mean you lose your midwives. You just add to the team, right, if there's something that's beyond our scope. We have a website, Port Alberni Midwifery. You can check us out there. We also have an intake form if you think you'd like to come into care with us. Our contact information is on the page as well if you just want to drop us a line, find out where our clinic is. You don't need to be referred by a doctor. We're primary care providers, so you can call us yourself, but of course we accept referrals through your GP office as well.
Hi, welcome to Public Health. My name is Emily. I'm one of the public health nurses here at the Port Alberni Health Unit. We offer support for pregnant women, their babies, children, and families. Each family is unique in their experience, and public health aims to provide a safe environment and create meaningful relationships. There are a number of ways to connect with us. You are welcome to call the Public Health Unit and ask to speak to a public health nurse, drop in or fill out a right from the start registration form, which can be found online on our Island Health webpage. For prenatal services, we can assist in identifying topics important to you during your pregnancy, such as nutrition, lifestyle factors, community support, and your hopes for your pregnancy and birth. You may want information about getting ready for your baby's arrival, including what to expect when feeding and caring for your new baby. For postpartum support, we recognize being at home with a new baby can be an emotional time. We offer support to new moms and their babies, including infant feeding and focusing on you and your baby's well-being and care. For family and community health, we can talk to you about locating the services in your community that could be helpful during your pregnancy and those newly parenting. From transportation and housing to nutritional support, we can provide referrals to health and community resources as needed. For child health clinics, we provide immunizations and growth and development assessments, starting at 2 months of age. We look forward to connecting with you.
The main entrance doors to the hospital are open from 7 a.m. to 7 p.m. If coming to the hospital at any other times, please use the emergency entrance to the hospital. You do not have to stop at admitting, and you can come directly to labor and delivery.
Hi, my name is Christy. And my name is Sarah. We are nurses at the West Coast General Birthing Center. Let's go check it out. Come on in. So when you present to the hospital for assessment of labor or for a non-stress test, you can just bypass the admitting desk and come straight down to labor and delivery. So this is the assessment room. This is where you will come for outpatient visits if you're sent up from your doctor's office or the midwives. And also this is where we assess you if you're going to be admitted into the hospital.
This is our nurses' station and nursery area. You can see how close they are together. If your baby is requiring closer observation or some medical support, they will be brought to this area. We have all the equipment that is needed to help support your baby if they should require any assistance.
So this is our maternity bed. It's a delivery bed. And Christy, our patient here, is quite comfortable in it. The head of the bed can lower and raise. So if you're wanting to lay back a little bit for your labor or sit up. And then the foot of the bed also goes down so that we can use the squat bar. So this is one way to help with your progression of your labor. And then we can remove the bar, lift the feet up, and then there's stirrups for pushing. So the foot of the bed also comes apart in case the doctors or midwives are needing access to the perineum for delivery. And then the bed can come up as well, just making it easier for the physicians and midwives. So Christy is now demonstrating our peanut balls. So we have 4 different sizes of these peanut balls. This is a mid-size one. So this is great for positioning in labor while you're pushing or even for comfort. So this would be one where you're trying to open your pelvis up to push the baby down. And then we'll get Christy to roll over onto all 4s. And this is another good one for while you're in labor, in first stage labor or second stage even, and we can get the legs opened a bit, and this helps to open the pelvis up as well and aids in easy descent of the fetus. And then we can easily monitor the baby still. Mom's comfortable. And then there is access to the Entonox if she needs it. So we can do all of the things while mom's in labor. We can monitor the baby, she can have pain relief, and she's doing great on the ball, keeping the pelvis open. All of our delivery suites have a private bathroom for patients and the support person to use. All rooms have showers with unlimited hot water to use as a comfort measure during labor. So another nice option for pain management in labor, which is my favorite, is the shower. We can bring the peanut ball into the shower, and then mom can labor on the ball, and then having her hips open will help the baby descend. And then we can use the hot water on mom's back, give some sacral pressure, and help her with her labor pain that way. And as far as I know, we don't run out of hot water, so you can be in here as long as you like.
Meal trays will be provided for you and your support person. You may want to bring your own pillow, music, speakers, your phone charger, shampoos, lotions, oils, toothbrush, and slippers. You're also welcome to bring non-perishable snacks and a cooler with any perishable food items you may like. This is an example of a chair that turns into a bed that dads can sleep in. All linens and pillows are provided for the dad's comfort.
This is our baby bassinet, and it is stocked and supplies are provided for your stay. You will not need any baby supplies while you're in the hospital. If you prefer to bring in your own products from home, you are more than welcome to do so. Please have plans to bring your baby car seat into the hospital prior to discharge home.
If at any time you are requiring a C-section, our unit has quick access into our operating room. Typically, a woman is awake during a C-section. If you are awake during your C-section, your partner or support person is welcome to come into the OR and will be sitting beside you when your baby is born.
Skin to skin with baby and mom is our goal in the OR and recovery room. This practice allows for the baby and mother to stay together and start initial breastfeeds if you're planning on nursing your baby.
You can reach the labor and delivery ward at any time, day or night, by calling 250-731-1300, and our extension is 48194. Hopefully you found this video to be helpful. We look forward to being a part of welcoming your baby into the world. All the best to you and your family.